It was a normal summer day. The children were playing in the playroom in an adjacent room to the kitchen. And I could hear them laughing and playing and giggling as I cleaned the kitchen. And all of a sudden, I no longer heard them laughing. There is a door leading out of the playroom into the garage, which the garage had a door leading to the pool. And when I grabbed that knob and it was unlocked, my throat just dropped right into my stomach. And I knew they were outside. When I saw Tap laying face down in the pool, I screamed help as loud as I could and jumped in. And I grabbed him and flipped him over. And he was not alive. So I ran him back through the garage and opened the garage door and put him on the front porch, where I continued to scream because that way someone could find us a little bit easier. Not even a minute and a half after being on the front porch, a Terminex driver drove into the driveway and 3 neighbors came running. They'd already called 911. And the ambulance got there and they took him.
I was in shock because I didn't know it was as bad as it really was because I wasn't here. They had him intubated, had him on the breathing machine. We were in the PICU 11 days.
Every day was different between the MRIs, the child life specialists, helping my daughter, who was 3 years old at the time, Gardner. They played with her on the 3rd floor of the Children's Hospital and the Child Life Center, which was a godsend for her, especially, and for us as parents.
What was so nice in the PICU were the people. So the doctors, the nurses, the technicians. Each doctor that came in there, they were all on the same page. You never had any confusion on, one doctor thinking one thing and another doctor thinking the other thing. It was, they met before each round. It was a wonderful experience, as wonderful as it could be.
They personalized what was happening. We meant something in our family and our child. It actually mattered to them. It was not just a paycheck. Tap's recovery was extremely quick. We all were floored. They had already scheduled us a room at Levine Children's Rehabilitation Hospital in Charlotte, thinking that there was at least a 90% chance that we would have to be there for some sort of therapy. And he exceeded everyone's expectations. We were able to leave the hospital with a 100% healthy child. This year we had a celebration of Tap's life, get together with the doctors and their families and some of our very close friends and family here just to celebrate Tap's life in remembrance of what happened and to feel how blessed we are to have had the outcome that we have. So much work was done on the front porch and the swarms of people that came in to help. It all happened right there on the porch. So that is why I wrote the words, Porch of Life, on the front porch, to help me remember. We have an invaluable resource here in Columbia with the Children's Hospital. People are getting the very best of care, and people should find great comfort in knowing that we have such a wonderful place.